Okay, so what can you expect if you haven't been to a dental office for years, right? What's going on with modern dentistry? What's changed since the last time you set foot in a tooth repair shop? Let me tell you, this isn't your grandparents' dental office anymore. No, sir, things have changed. Things are different. The first thing we do is we have you run the Gauntlet of Shame. This is where we track down all of the most attractive people who have turned you down for dates throughout your life and line them up, and you have to run past them, and they just point at you and call you a coward with ugly teeth. You probably will cry. You probably will never recover from the trauma, but that's okay. Don't worry. This is all part of the healing process in your dental journey. The second step is to have you walk the hall of extracted teeth. This is kind of like walking across hot coals or a bed of nails, except it's mostly extracted human teeth. There might be some other stuff in there. I don't really pay that much attention. But the point is, if you can walk barefoot across a bunch of extracted human teeth, having a little dental work done, that's not so scary, right? Look, I'm kidding, okay? We don't make you walk across a pile of extracted human teeth. Listen, it's an option out back, but you gotta pay extra, and you're gonna have to talk to Jimmy. But you didn't hear that from me. But it's not mandatory. Don't worry about it. People will believe anything they hear on the internet, right? You know, somebody's going to run this up the chain to BuzzFeed. 10 reasons why dental offices should be illegal. Number 6, they try to make you walk across extracted human teeth against your will. I'm Mike, I'm a dentist. You're afraid of me, I'm sorry, whatever. We're going to try to make this dental thing a little less freaky with a freaky little YouTube video. Pause the video, read this. You're responsible for your life. I'm not responsible for your life. If catastrophe befalls you as a result of this video, that had nothing to do with me. First things first, why do you want to go to the dentist, right? This is a scary place to you, you don't like it, but for some reason you're still willing to go. Why is that? What do you want out of the deal? You must want something. I want to help you get clarity on what that is. Lots of patients don't know what they want because they don't really know what's possible. Let's cover the basics. What do human beings use their mouth and smile for? Basically, you want it to look good and function well. Everyone has different definitions of what is good enough for their smile and their mouth. Me personally, I need my teeth to function very well. I have this weird throat esophagus disability thing where none of the nerves in my esophagus work. Basically, my esophagus doesn't push food down into my stomach, so I have to chew everything, pulverize everything into mush, just really grind it, mush it up, chomp chomp with my teeth before I can swallow everything. If it is not mush, it gets stuck in my throat and it hurts very badly. Very painful, not fun. I've passed out before. Feels like one of those weird alien chest burster things is trying to rip out of my throat. It's not fun, it hurts a lot. So everything must be mush, so my teeth must be functioning well. If I couldn't chew everything into mush, my diet would be very limited. There would be a lot of foods that I would not be able to eat. And that becomes a nutritional problem, right? People on soft food diets often do not get appropriate nutrition. Not to mention, it's not exactly the tastiest way to go through life. Trust me, you don't want dentures, okay? Denture patients do not like how limited their ability to eat food becomes. It's not fun. So we want our teeth to function so that we can eat food. We also want our teeth to function and our mouth to be healthy so that we can speak. What I'm doing right now. The sounds you make with your face are very dependent on your lips, tongue, teeth. Ha ha ha, hoo hoo hoo. Lots of mouth region stuff. If your teeth get messed up, it can actually change the way you sound. Just ask a patient with dentures how easy it is to learn to speak again. It is not easy. It takes a while to learn how to do. It takes a lot of work, and the way they pronounce things may sound a little bit different. Another example, Freddie Mercury famously did not want to straighten his teeth with braces because he was worried it might affect his singing voice. So maybe his teeth didn't need fixing, right? Maybe he just valued the functional capabilities of his teeth more than the aesthetic appeal. Also, keep in mind, sometimes just owning your flaws can also be attractive.
Hello there, you like my pretty smile? You like my pretty smile? Like my smile?
See, some people would call what I just did a character flaw or a personality disorder, okay? Well, maybe that's just who I am. A personality disorder, okay? Maybe you need to accept that. So we want to be able to speak. We want to be able to eat. We want to be able to flash a pretty smile so people like our stupid faces at job interviews and on dates, etc. Maybe it's society's obsession with straight teeth that's the problem. Did you ever think about that, Jack? We want the social function of a smile, right? So that our peers accept us and we aren't isolated and lonely and lonely and lonely and lonely. Humans, we don't like those emotions. We're social animals.
Please don't leave me. I'm so lonely. I tried talking to the cats, but they don't always talk back to me. Plus, they scratch me when I'm sleeping. I don't really like that.
Right? We don't like being lonely, right? We'll even overcome our fear of the dentist, right? Of people like me, so that we cannot feel those feelings of loneliness, right? The scaredness of the dentist is not as strong of an emotion as the loneliness of loneliness. We'll go to a dental office that we're scared of to improve our chances of getting a smile that might not make us as lonely and sad, because people will accept us as acceptable human beings. We're social animals, and cats and dogs aren't always enough. Last reason we go to a dentist, but a pretty common one, something freaking hurts. Doggone it, something friggin' hurts McGurts. Please make it stop. Why does it hurt so much? Something starts to feel not normal, we start getting scared. What's going on here? That fear of the unknown, scary mystery in our mouth is even scarier than talking to a freako McGeeko like myself. So that's why we're in the dental chair. Either we hope to gain something of value, right? Better function, a better smile, maybe get rid of a bad smell, or we hope to stop something bad, right? Pain or anxiety about the state of our health. And I know I haven't told you much about what to expect from a dental visit yet. You can skip to those parts of the video by using the chapter headings in the video description, but this is important. I want to help you figure out why you're going to the dentist, because the more transparent you are with your motives, the easier it's going to be for the dentist to explain things in a way that is relevant to what you want. How important is your oral health to you, right? Do you really care very much if you have tooth pain or tooth loss later in life? Some people don't, maybe that's fine. Or maybe it isn't. Maybe you should care more about the health of your body. I know that sounds judgmental, but bear with me for a second. Maybe your body is more valuable than you think and you're not valuing it appropriately at the moment for many potential reasons. I will say that oral hygiene, right, taking care of your teeth, your mouth, your gums, is one of the first things out the window when you're struggling with depression. It's okay to struggle with depression. That's normal. You're a human being. It's hard to exist as a human being, all right? It's not easy. Life's tough. Life's very hard. Just read some poetry or some existential philosophy. Lots of people struggle with these issues, right? What is the meaning of life? Nobody knows. Nobody knows. It's actually, it's sneaky. It's variable. It's not easy to pin it down and be like, this is the meaning of life forever and always, and it's settled. It's like, no, life is hard and doesn't always seem that meaningful, and you're allowed to get depressed. I've been depressed many times in my life. You stop taking care of yourself. I see lots of patients dealing with depression. And admittedly, it's hard to handle very much when your emotional state is stuck down in a clogged toilet of a very dark basement underneath a haunted house. Sometimes you just got to take a year off from life to be sad. I get it. What have you been up to, Mike? Mostly just trying to curl up in a ball in the corner of my room and sleep the pain away. Unfortunately, you can't sleep 24 hours a day. Did you know koalas sleep like 22 hours a day? Something crazy like 21, 22 hours a day. Sometimes I envy the koala. I have a theory that all koalas are depressed, and that if we started giving them like antidepressants and caffeine, that maybe we'd start seeing koalas do like wild and crazy stuff. You know what I mean? Just like, whoa, what's going on with that koala? It's only had 6 hours of sleep. We've never seen this kind of behavior before. Anyway, the point is, dentistry is not always a priority. Sometimes there's other stuff you need to get sorted out in your life before you're ready to tackle improving your oral health. That is fine and totally okay. These videos will still be here whenever you're ready. If you do happen to have an interest in trying to take some baby steps to improve your oral health, I would recommend checking out James Clear's book, Atomic Habits, and applying his 2-minute rule to oral hygiene habits like brushing and flossing. 2-minute rule, brushing and flossing, James Clear, Atomic Habits. Yeah. All right, so that's oral health, right? Function, that's one thing. Then the second question is, how important is the look of your smile? Are you happy with it, or are there ways in which you would like to see it improved? So now, finally, I'm going to walk you through a typical new dental patient visit and talk to you about what the dental staff and the dentist are likely to do and why. That way you'll have both a better idea of what to expect, kind of set your mind at ease, like, okay, this is normal, this is why they're doing this, and also hopefully a better understanding of how to navigate a dental office to get what you want. Point of view, POV. You are a new dental patient in a dental chair at a new dental office. What to expect? X-rays will be taken by a dental assistant or dental hygienist. Hygienist. I can't even say words anymore. Hygienist. I just made up a new dental term. I don't care. I'm leaving it in. They will put a little plastic thingy in your mouth and ask you to hold still. You will do so like an obedient dog because you want the dental assistant or dental hygienist to like you. You are a people pleaser, and we thank you for that. You will then go into a separate space and bite on another little plastic thingy. A weird robot arm will spin around your head. And you will be presented with a Picasso-like x-ray of your face that spreads it out in 2 dimensions. It's weird. It's like this. It's like if you took your skull and jaw and like unfolded it like a Picasso thing so it was flat. You'll see that x-ray and you go, well, that looks really weird. And we'll go, yeah, everybody says that. Why are these x-rays taken? The ones where you bite on the back teeth and they have a little x-ray gun coming to the side of your cheek, that thing, those are taken to check for cavities in between your back teeth. Dentists cannot see in between your teeth with our eyeballs because we do not have x-ray vision yet. Genetic engineers, keep working on that. Thank you. These x-rays help us catch a cavity when it is little, right? We want to catch a cavity when it's little because little cavities only require little fillings. If you put a small filling in a tooth, it keeps the tooth structurally sound and stable for chewing on, right? Catch a cavity early, put a tiny filling in, stop the filling before it gets big, change your habits so that you're staying healthy at home, no big cavities, decreases the likelihood that you bite on something crunchy someday and crack a tooth. We don't like cracked teeth. Cracked teeth are not fun. They hurt. If a filling is necessary, better to have a little filling because it makes it less likely that you're going to end up with a toothache. How do we avoid getting any cavities in between our back teeth in the first place? By flossing and following the snack guide rules on thedentistdad.com/snack guide. All right, I'll link that in the video description. Check it out. I also have a video on how to floss your teeth. You can check that out on my channel. I also have a video that goes into more detail about how to never get a cavity. You can watch that on my channel. You don't have to get cavities, but if you do get cavities, we want to catch them when they're little. Small fillings are better than big fillings. Less likely to hit the nerve on a tooth and cause a toothache. Less likely to have a big filling that cracks when you're chewing on something. Small fillings, good. If we waited until a cavity was visible to the human eye, it's going to be a really big cavity, right? So you want to take x-rays. It helps us catch cavities early. Why do we take the robot spinny arm Picasso x-ray? Why do we do that one? This one gives us an overview of your entire jaw structure. Nasal sinuses, teeth, bone under the teeth. Basically, we're looking at you thinking, anything weird going on here? Any extra teeth, impacted teeth, weird little cysts down in the bone? Do we have bone loss from smoking? Any weird asymmetries as we look from left to right? Any previous surgical reconstructions performed? You got any fancy metal hardware stitching your jaw bones and skull back together? Any shrapnel from bullet wounds? I've seen that before. Yeah, just a bullet that was just in somebody's zygoma cheek region. Very specific anatomically correct terms used on this YouTube channel. You know, how many teeth we got in here total, right? Is this a salvageable situation to try to restore each of these individual teeth, or are we talking major tooth replacement options here? You know, if we're talking about major tooth replacement options, how much bone do we have left to work with? Are implants going to be an option? Are dentures a viable solution for this patient? Will bone grafting or soft tissue repositioning surgery be necessary? Blah, 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 yada, yada, yada. Basically, this is an overview x-ray that helps with treatment planning and generally otherwise is fairly uneventful, but sometimes you still catch something that's important to see that you wouldn't have noticed any other way. As a quick aside here about x-rays, you see a lot of corporate dental chains, corporate dental offices advertising discount x-rays and exams these days. I would be careful with that. To be honest, if they're trying to get you in the door with deals, that's a red flag to me, right? Cutting corners in healthcare just generally not a smart path to go down. I see a lot of patients who have gone to these offices and they get you in the door with the deal, right? And then all of a sudden they diagnose that you need a ton of work done that you may or may not need. From what I've seen, many of these offices have a magical ability to diagnose cavities that I can't find anywhere. The reality is it costs a certain amount of money to have a dentist and dental staff conduct a thorough diagnostic exam. I would suggest paying what that costs so you have a real idea of what is going on. Now, that's not a guarantee that if you go to a more expensive office that you're not going to be overdiagnosed. Sure, that could happen, but that business, that dentist, that dental staff have less of an incentive to do that because they're not losing money on that first visit. As a general principle, if a business is losing money by providing a service, I would be careful with that business, right? That's just my 2 cents. Personally, I think it's better to pay what things actually cost, no matter, what you're paying for, what part of the process you're in. It's just better to pay what the thing actually costs, because then there's less of an incentive for you to get taken advantage of, because the business is going to make up that cost somehow, right? You can't run a business if you're losing money. Just my opinion though, right? For whatever that's worth, whatever level of credence you want to give to the nonsense that pops out of my head. And always do get a second opinion if something seems fishy to you, right? I never get offended if a patient goes and gets a second opinion from another dentist. Like, I wouldn't trust me either. I mean, look at me. I'm a monster. Probable con artist. Likely scoundrel. A rapscallion. An evildoer. Also, fully certified idiot. Definitely cross-check everything I'm saying with other dental YouTube channels, right? You'd be a fool not to. I've been wrong before. I'll be wrong again. I'm certain of it. If something seems off about what you're being told, get a second opinion. Also, I fully understand that many people watching this video cannot afford to go to a dental office to get x-rays from a single dentist, let alone to afford to get a second opinion. I understand people are in that position. Lots of people. Life is not fair. Things are incredibly difficult and expensive. The rat race is ruthless. Useful skills and decent paying jobs are wildly difficult to obtain these days in a lot of cases. However, that is also why I'm making these videos, right? It's the least expensive dentistry I can create for people. It's the most accessible dentistry that I can create for people. It's not the same as real world dentistry, but it's certainly better than nothing. I obviously can't fix every dental problem just by talking to you, but I do believe that preventative medicine is the best medicine, and I think together we can prevent a lot of problems before they start. All right, hopping off my soapbox. All right, so you got your x-rays. Cool, sweet, awesome. Next step, let's measure your gum tissue. What does that mean? All right, so basically we use a tiny little ruler stick thing and we measure around the sides of your tooth to determine how much support structure your tooth has, right? Your teeth need support. There's like your teeth sit down in the jawbone and there's all these little ligaments coming out of the bone and gum tissue, and it attaches around the tooth. And then when you bite on things, your tooth kind of bungees up and down a little bit in this like shock absorber of these ligaments. And you need gum and bone tissue tightly adapted around the teeth. You want that to be squeezed in there tight so like bacteria and gunk and food from the mouth isn't packing down in the gum tissue where it can cause infection and inflammation and irritation and bone loss, because if you lose the support structure around the tooth becomes loose and you can end up losing a tooth, not because there's anything wrong with the tooth, but because the support structure has gone kapooey. What makes it more likely that gum and bone tissue around teeth is going to break down from infection and inflammation? Smoking makes this worse. Not flossing makes this more likely to become a problem. If you have uncontrolled diabetes, that's kind of a weird term, uncontrolled. If your diabetes has gone rogue, you can be more at risk. If you keep your diabetes in check, like my good man Wilfred Brimley, hard name to say if you're not ready for it, Wilfred Brimley. Like Wilfred recommends, your gums should be okay. Control them HbA1c numbers, right? Don't let them run wild like a raging bull. All right, so this ruler underneath your gums, what does this feel like to you? Usually it's not too bad. I have some patients that, they wince a little bit, while I'm doing it. I try to be as gentle as I can, whenever I see that somebody's a little annoyed by what I'm doing, I check in. I'm like, hey, is that okay? And people are like, yeah, it's fine, just get it over with, So, it can be a little bit uncomfortable. Other patients like to be on nitrous and have their mouth, numbed up with some gel to have this done. That's also fine. Whatever patient category you fall into where it's no big deal, you don't even flinch, you're wincing a little bit, but you're annoyed, but it's fine. Or you're like, no, don't touch me, give me some nummy stuff. That's fine too, but it's important to have this done to assess the health of your gums. This is where you're going to hear me reading off a bunch of numbers, like 3, 2, 3, 4, 1, 5, 2, 3, 6, but you're just going to keep hearing numbers over and over again as I go around with the ruler. It's one of the more boring parts of my job. Usually while I'm doing it, I think about, rolling out of a moving vehicle or something like that. But somebody's got to do it. So sometimes that somebody's me. We all have to do boring things sometimes, like editing YouTube videos. So I'm touching you with a little ruler. It kind of bugs you a little bit. Why are we doing this? What do the numbers that I'm reading off mean? The numbers are measurements of how far that ruler goes underneath the gum tissue before it contacts bone. Ideally, we want these numbers to be 3s and below, right? If we start getting a bunch of 4s, we're on the highway to the danger zone, right? You start getting 5s, we're in the danger zone, all right? You are losing bone and gum tissue support around your teeth. We want to reverse that process. Again, we could end up losing teeth, not because there's anything wrong with the teeth, but because we're losing support structure around the teeth. You start getting 6s, 5, 6, pick up sticks and start flossing your teeth with them. We got a problem here. You're going to be spending some extra time getting to know your hygienist. Hopefully you like him or her. They're going to numb up your mouth and get your teeth and gums super clean, right? Power clean. So clean you might even be a little bit sore afterwards, right? No pain, no gain. It's time to hit the mouth gym with your hygienist, right? They're your personal trainer for your mouth. Hygienist. Hygienist. Hydrogenist. Hygienist. Oh, that got dangerous. Hygienist. So hit the mouth gym. It's worth it. What if your measurements are 7s and 8s? 7, 8, roller skate into a wall. Your mouth is falling apart. You may as well just knock your teeth out because they're probably getting loose and wiggly anyway, right? That's for baby teeth. We shouldn't have adult teeth getting loose and wiggly. What are we doing? But no, don't roller skate into a wall. I'm sorry. That was rude of me. I got a little carried away by my roller skates. 7 and 8s, actually you can still save these teeth, but we're going to need you to see a periodontist. That is a specialist in the dental world who focuses on healing the support structure, the gums and bones around teeth. Perio, around, dentist, it's like teeth, around teeth. That's what that specialist does. Periodontist, around the teeth. I think it's from Greek or something. I don't know. You can Google it. If we get pockets that are deeper than 6 millimeters, you're going to go see a periodontist. Also, and this is really important, gum disease typically does not hurt. So a lot of patients come in, they don't think they have any problems. We start taking these measurements and it turns out, oh wow, we've got a lot going on here that we need to fix, right? It's not a painful disease and it can progress without you knowing. So if you haven't been to the dentist for a long time, especially if you smoke or if you're diabetic and you've had issues with controlling your blood sugar levels, and if you don't floss, these are risk factors for gum disease, and you want to get that checked out by a dentist so that you know where you stand. And it's really important to pay attention to this and make sure you're getting these measurements at the outset of any dental treatment, because you don't want to spend a bunch of money restoring and fixing teeth if they have severe gum disease, right? Do you want to invest a bunch of time and energy and money fixing a tooth that then you lose because the gum and bone tissue around it broke down? No, you don't want to do that. That's a bad idea, right? So we got to take these measurements at the beginning and say, okay, is the foundation for our house sturdy, right? The gum and bone tissue in the mouth are the foundation for your mouth house. You need a strong foundation, right? 3 little pigs don't build your teeth on a straw house. If you want to get biblical, I think there's something in there about, building houses on sand, how that's a bad idea, right? We don't want to build teeth on sand. Don't build on straw, don't build on sand, don't build on weak, diseased gum and bone tissue. Get it? Good. Also, dental implants do not do well if you have diseased gum and bone tissue. So don't think that, oh, it's fine, I'll just lose all my teeth and then I'll put implants in. If you have periodontal disease, if you have gum disease, the implants are more likely to fail as well. Oh, I'll just let all my teeth fail and then spend 50 grand replacing them with dental implants. Not so fast, those implants may also fail. So now you've lost all of your teeth and you've invested 50 grand in new ones, and then those went kaput as well. We don't want to do that. We want to stop gum disease. It's important. If you continue smoking and you're not cleaning well underneath the denture that's attached to your implants, and you don't wear a night guard at night to protect the implants from excessive forces that can be generated from grinding your dentures, right? Even screw retained dentures, you can still grind on those at night, damage the denture, potentially break down the connection between the bone and the implants, especially if you have gum disease. What I'm getting at is, no matter what, you can't get away from gum and bone disease being a problem no matter what you put in your mouth, right? It's a relevant issue to you, so it's important to understand and be proactive in preventing this problem. So what I'm trying to say is, no matter what, we are partners in your health, right? We've got to back up any dental work that we do in an office with good, healthy habits at home. Again, James Clear, Atomic Habits. Look up the book, check it out, read it. He's got a website, he writes articles, he sends emails. James Clear, check it out. All right, let's say you made it through the gum measurement process with the little ruler and all of your measurements were good. Congratulations. At this point in your appointment, your teeth will now likely be cleaned by your hygienist. Your hygienist will remove tartar and plaque underneath the gums and around the sides of the teeth to prevent you from getting gum disease in the future, right? We want to start with a clean slate. They will do that with those cute little scraper thingies that you love so much and tell all your friends about when you leave. Oh, they used the scraper on me again at the dental office and it was, gee golly, it was great. That's what you say to your friends. Now, a lot of times if you need that more advanced cleaning because you have gum and bone tissue loss, if you do have significant gum disease and bone problems, it is likely that you will actually be rescheduled for a separate cleaning. You're not going to get your teeth cleaned at that first appointment. This can be upsetting for a lot of patients. So like, I came in here to get my teeth cleaned and now I'm not getting my teeth cleaned. What the heck is this? Yeah, we have to take care of the more significant problem. And if you're using dental insurance, a lot of times there's approval processes for that, and dental insurance won't pay for you to have your teeth cleaned and then have your teeth cleaned the more advanced way. It's a whole thing. If you're not using dental insurance and you got tons of gobs and gobs of money, this is probably irrelevant to you, but that's not most people's situation. Your gums might bleed. You will be upset. You will say things like, "My gums are bleeding because you are poking me." This will actually only be half true. Yes, an instrument is going underneath your gums, and your gums are bleeding in part because of the intrusion of this instrument. They probably wouldn't have bled spontaneously without it. However, your gums do not have to be sensitive in this way, and they do not have to bleed when these instruments are cleaning underneath your gum tissue. The reason your gums are bleeding is because you have a low-grade infection underneath your gums and on the sides of your teeth. Bacteria that live inside all of our mouths have colonized your teeth and gums. You don't like colonizers, do you? Europeans who went all over the world enslaving and abusing people from other cultures because they stole gunpowder from China? White devils, like my ancestors and me. Good, we agree, colonizers are bad. Now, you have colonizers inside your mouth. Bacterial colonizers. You have a desire to get rid of these foreign devils trying to spread their patriarchal Western culture, do you not? How dare they try to implant Shakespeare underneath your gums? How do we evict the white devil? We use the other white devil, floss. Yeah, we floss. We floss, we floss, we floss, we floss, we floss. That was my attempt at European opera singing. Did the opera originate in Europe? I don't know. Tells you how much I care about my history. Okay. If we floss properly and consistently after a thorough dental cleaning, if we do this every night for about a week, our gums will stop being sensitive and they will stop bleeding. It magically won't sting anymore when you floss. It won't hurt when you go in for dental cleanings. Your life will just be a little bit healthier, a little bit better. And you'll have the satisfaction of being one of those people. One of those goody two-shoes flossers. Don't you want to have two shoes? We're not a cult. We are a cult, but we're not weird. Just enjoy teeth. Floss with us. One of us. One of us. One of... We just like having shoes. Again, I made a video about flossing. You can watch that. Skip to the part where it talks about the proper technique. In addition to using the scrapers that you love so much, your hygienist might use something called a cavitron. Is this a transformer, a Decepticon, an Autobot? Maybe, I don't know. For our purposes, it is a very gentle, vibrating tooth jackhammer that sprays water bubbles to break tartar off of your teeth. I say jackhammer because I'm being silly. Most patients find this to be quite comfortable, and it speeds up your dental cleaning a lot. It's way easier to break tartar off the teeth using a Cavitron, Autobot, Decepticon, Transformer thingy. These are a little bit messy. You might get a little bit wet. My dental assistants like to joke that we're giving patients showers or facials. I think those usually involve cucumbers, do they not? So that could be fun. You could just wear some cucumbers into your dental appointment, right? You could just kind of... That people would get a kick out of that if you showed up wearing cucumbers. You have little holes cut in them, or just, I don't know, just pull a couple of cucumbers out of your pocket when you go in for your dental cleaning. Just pop those on. Don't say anything to anyone. Just do it. They'll be like, all right, this person. They're either gonna be like, all right, this person is really chill, or serial killer. One or the other. I don't know. But try that experiment. Make that a trend on TikTok, right? I'm on TikTok. Go tell people you were told to put cucumbers on your eyes by Mike the Dentist on TikTok. And I can get in trouble for whatever legal problems that causes. Cucumber slices, by the way. I think that people understand that. You're not putting whole cucumbers. Come on. Cucumber party! Let's say you are an avid brusher and flosser, but you still get sensitive teeth when you go in for dental cleanings. What can be done? If it's the teeth that are sensitive, you should try using an anti-sensitivity toothpaste. These are toothpastes that contain either stannous fluoride or potassium nitrate. You're going to want to use this toothpaste continuously. If you stop using it, the effect will stop happening and you'll get sensitive teeth again. And it takes a few weeks of continuous use for the effect to kick in and start working. There's that. If it's the gums that are sensitive, I would recommend having your hygienist use a numbing product, a gel, to distribute around your gum tissue during your cleanings. There are a number of different gel products that can be used. These don't require needles to be distributed around the gums. Sometimes there can be a mild amount of discomfort when the gel is being administered, but it's not a poke, it's not a stick, it's not a needle. No needle necessary. You can put some gel around your gums, numb up the gums, make the cleaning more comfortable. If you're doing both of these things and you're still not comfortable, I would probably recommend trying out nitrous oxide with your cleanings, right? Nitrous oxide is a gas that's in and out of your system quickly. It doesn't affect you driving home from your dental appointment, but it helps you relax, it helps with anxiety, can help a little bit with pain relief. If you're having trouble with dental cleanings, you're nervous about dental treatment in general, a little bit of nitrous oxide can go a long way. I also made a more detailed video for patients who are scared of the dentist and have a hard time with dental appointments. It talks about nitrous oxide, talks about oral sedation, talks about IV sedation. You can check out that video on my channel. Also, if you have a real hard time with dental cleanings, it wouldn't hurt to take a little bit of ibuprofen a couple hours before your cleaning, maybe a little bit of Tylenol, just to get a little bit of pain reliever in your system. In general, dental cleanings really shouldn't be painful if the gums and teeth are healthy, but if you have sensitive teeth, if you have sensitive gums, a little bit of acetaminophen, a little bit of ibuprofen might help you out. So after your hygienist is done with the scrapers and the Cavitron, it's now time to polish your teeth. That's the little spinny brush with the gritty stuff that tickles on your gums. This is the part that most people show up for dental cleanings for. It's the thing that makes your teeth feel like they're cleaner, right? Really, it's just a polisher. It helps remove stains from the teeth. That's what you're there for, right? You don't care whether your teeth are healthier. You just want the stains to be gone. You just want it to look good. That's why you showed up for this. That's what really matters, presentation, right? If after that polishing has been completed for stain removal, you're still not happy with the color of your teeth, or if there are still stains present on your teeth, I also made a video about the best way to whiten your teeth at home. You can go watch that. It's actually not that difficult. It's not that expensive, but you have to understand how to do it properly, and honestly, most people don't. Check out that video, follow the tooth whitening instructions and rules. So your hygienist has cleaned under your gums, your hygienist has polished the stains off your teeth. Hopefully then your hygienist is going to go over some specific things you can do at home to make sure you're keeping your teeth healthy based on some early signs of issues that she may be observing with your teeth and gums. I also understand that it's not always fun to get a health spiel when you're at the dental office. Sometimes you just want to get in and out and go. You're not really in the mood while you're there to listen to what a hygienist or a dentist is saying. Again, that's why I've made all these videos on my YouTube channel so that you can get this information when you're in the mood for it. Preventative medicine, it's more important than anything that happens in a dental office. You can quote me. Your hygienist may also ask you if you want to have a fluoride treatment at your dental visit. What is the difference between the fluoride that you have in your toothpaste at home or your mouthwash at home and the fluoride that's available at a dental office? Basically just the concentration of the fluoride, right? We have highly concentrated stuff, right? We've got the black market stuff, the good stuff. You're not allowed to have it. Yeah, so it's the concentration of the fluoride that's in the fluoride that we give you. Should you get a fluoride treatment at your dental office? If we're talking about kids, most of the time dental insurance is going to cover fluoride treatment for kids, in which case you're already paying for it. If you're paying for your dental insurance, it's rolled into the cost of your dental insurance. I would suggest getting fluoride on your kids' teeth. Much like a flu shot, you're already paying for it with your insurance premiums, whether you decide to get it or not. So why not get it? It makes the teeth stronger and more resistant to decay, so why not? Now, for adults, a lot of times insurance does not cover fluoride treatment, which to me does actually make sense because in my mind, insurance is for when you have problems come up that are unexpected. Fluoride is actually a preventative service. If you're an adult, do you need it? That depends. Do you have a history of getting a lot of cavities? Are you brushing and flossing every night? Do you eat something similar to a paleo diet or a keto diet? Or do you tend to snack periodically on carbs and sugar throughout the day? If you're high risk for cavities, I would get a fluoride treatment. If you've never had a cavity in your life and you're following the advice I'm giving you on these YouTube videos, you probably don't need it. Okay, so your hygienist is done with you, your mouth feels fresh to death, you're ready to get back out in the world and show off those pearly whites. But wait, you still gotta talk to Captain Jerkface himself. That's right, the White Devil, the third worst human being on the planet, the evil tooth surgeon, Mr. or Mrs. Freaky Pants, the dentist. You still have to talk to the dentist. But I don't wanna! Sorry. It's the law. We legally have to look at your mouth if you have your teeth cleaned. Can't have your teeth cleaned independently. If you don't like that, write your congresspeople. You don't have to see a dermatologist to have your nails done. Why do you have to see a dentist to have your teeth cleaned? I don't understand. I don't know, man. The rules are all made up. No, I think it would, honestly, it'd be a pretty bad idea, I think, to not require you to see a dentist every once in a while to have your teeth cleaned. It's already hard enough to convince people to let us look in their mouths. If we got rid of the whole teeth cleaning thing as an incentive, I think everyone's teeth would just fall apart. It would be bad. But again, just my opinion. Write your congresspeople if you disagree. So the dentist walks in the room, they're going to look in your mouth. You might say something cute like, now you're not allowed to find anything, or keep in mind I've got a vacation coming up, because you don't want us to tell you about any of the problems that you might have. It's always, awkward. It's an awkward conversation with the awkward turtle or whatever. I didn't do it right. Awkward turtle? Nope. Awkward turtle. See, I'm even awkward when I try to make an awkward turtle. I should look up how to do that before I try to do it on camera. Doesn't matter. That's okay though, because I'm an expert in navigating awkwardness because I create it all the time. You think you can create awkward tension in a room? Okay. Yeah, I'm about to reach my hands inside your head. All right? How's that for awkward? You amateur? I mean, seriously, have you been watching this video? So somebody is going to reach inside your mouth, say some things about what's going on. You're probably not going to understand what they're saying. That's what this YouTube channel is for, right? You can come back here, you can type some stuff in, and you can go, what the heck was that dental freak talking to me about? And then it'll hopefully make more sense to you. This is the part of the appointment where what I call the do I need this discussion happens. I like to break things down into 3 categories. Is this a problem now or very soon? Is this likely to be a problem in the future? Or is this a cosmetic improvement? Those are the most useful categories in my head. So again, category 1, do you need to get a move on this pretty urgently, or else you risk significant pain, dysfunction, or breakdown of teeth in the near future? Category 2, are there signs that a problem is brewing, but it's going to take a little while before it ends up getting worse? If treatment is necessary, this is the stuff you can start budgeting to take care of in the next year or two. Maybe you're a little short on dental cash right now. That's cool. At least you now have a plan for what you need to take care of on the horizon. Sometimes this stuff in category 2 isn't something that you have to have treatment for, but we do need to teach you how to improve your habits at home to keep this problem from escalating. Category 3, cosmetic improvements. To me, this is the fun stuff. Personally, I like helping people improve the way their smile looks. This is my favorite dentistry to do. You get that nice, satisfying visual payoff. The patient can actually see a difference. It's exciting. Now, I gotta be careful because I recognize this isn't necessarily the most important dentistry. There's an insane amount of unmet dental healthcare needs out there, and that is the primary focus of this channel, trying to alleviate that problem. But I still think helping people be more confident in their smile is also important. You know, we want function first, but once we have function, I think it's cool to give people a little self-esteem bump. I like doing that. So if you're talking to your dentist and you're trying to sort out your treatment plan, I would straight up ask them which of those 3 categories each of the things on your treatment plan fall into. Do the most urgent stuff as soon as you can. Take care of the preventative stuff once you have the budget for it. Then, once you have a strong foundation, make yourself look pretty. And no matter what stage of treatment you're at, make sure you're practicing healthy dental habits at home to keep all that fancy dental work in good shape. I always try to emphasize for patients that any dental work we do is not as strong as the original teeth. Unless the original teeth had some kind of genetic defect, which is relatively rare, then anything else we put in the mouth isn't going to be as strong and durable as the original. Dental materials are really impressive these days. It's still really good, but if the original broke down, then the dental work can break down. Healthy daily habits is the name of the game. So the goal of this first visit is to figure out what your health looks like now and then get on the same page with your dentist about what you want your health to look like in the future in your own terms. I want you to have the confidence to say, this is what I want out of my dental health. And then we as dentists have to explain, this is what it would take to get the result you are asking me for. If you want X level of comfort and function and pretty looks for your face, that will require Y level of treatment. Then you put your 2 heads together and you figure out, how is that treatment going to be accomplished? Will it be done by one dentist, or do you need to get specialists involved? Over what period of time will the treatment take place? How much will it cost? What will your experience be like at various stages of the treatment? Sometimes the body has to heal after certain steps in the treatment plan, so you can't get the result right away. Unfortunately, today there's a lot of competition in the dental marketplace that I think can be misleading. Patients are used to seeing commercials about, blazing fast dentistry and same-day dentistry and immediate dentistry and everything right now, here, for no cost. Speed of light, tooth straightening. I do have some unfortunate news for you. There are biological limitations to how fast you should be moving teeth, and if you get carried away, you can actually cause damage. Also, sometimes you need to do preliminary work before you get in there and start doing orthodontic movement of teeth. You have to modify or adjust things with other teeth, sometimes even remove teeth. If you skip steps, bad end result. But who cares? They already have your money. My point is, speed is not always better than taking your time and treatment planning for the end result that you really want. And I understand that as a patient, you can't always picture the end result you want, or you don't know what's possible. Again, why I'm making these YouTube videos. I've never built a house. I'm a lazy millennial. Always lived in apartments. I'm a renter. Always been a renter, because of my millennial laziness. But in deciding to build a house, I doubt you plan the whole thing in 1 hour with the contractor the very first day you meet, right? There's a little bit more of a process that goes into it, I would guess. Each plot of land is a little bit different. You can't just plunk the same house down on any random place and expect to get good results every time. People's mouths are also different. You have to plan for the individual mouth. You want a super healthy, functional, gorgeous mouth? Takes a little time and effort. A little bit of planning. So I think that summarizes pretty well what should be happening at initial dental appointments for new patients. Those steps are pretty standardized across the dental industry. I also made a video about what it might look like to come into a dental office if you're in pain. That's a little bit of a different experience, a little bit of a different focus. That video goes into a little bit of what that appointment is going to look like and how you shouldn't rush into making decisions even though you're in pain and you feel like you need to make a decision right now. Good advice in that video, if I do say so myself, and I do say so myself. because I did say so myself. I made both videos. I will also be making lots of videos that discuss other dental procedures and treatments in more detail, what to expect at those appointments, post-op instructions, how to prevent dental problems and injuries that could lead to the need for those treatments. I'm trying to build a library of content to answer common dental questions, as well as prevent common dental problems, and also to navigate those problems more smoothly when they do come up. The goal is to make dental care less stressful for both patients and dental care providers, right? I want this to be a win-win situation for everyone involved. All right, hope you're feeling better about meeting your new dentist. I'm sure he or she will be a lovely person. You two will get to know each other. You'll become the best of friends. All right, that's enough. Stop watching so much YouTube. Cut it out. Get outside, go for a walk, read a book. Thank you for watching. You're a gem. Adios. You don't have to see a dermatologist to have your nails done. Why do you have to see a dentist to have your teeth cleaned? I don't know. The rules are made up. We're not a cult. I'm about to put my hands inside your head. That's right, the white devil. How do we evict the white devil? The third worst person in the world. I say jackhammer, I say jackhammer, I say jackhammer. How's that for awkward, you amateur? 7-8, roller skate into a wall. Shards of a bullet in somebody's cheek. Don't you want to have two shoes? Floss, we floss, we floss, we floss. I have a theory that all koalas are depressed, and maybe if we started giving koalas like caffeine and antidepressants, that they'd start doing all kinds of wild stuff. You know, just like, whoa, what's going on with that koala? It's only had 6 hours of sleep. We've never seen this kind of behavior before. What is the meaning of life? Here's a secret. Nobody knows.
Please don't leave me. I'm so lonely. I try talking to the cats, but they scratch me when I'm sleeping. I don't really like that.
Hello, you like my pretty smile?
Maybe it's society's obsession with straight teeth that's the problem. Did you ever think about that, Jack? Now, if you pay extra, it's an option out back.